Thank you for joining us for CNTV. I'm Brad Clonch along with Quin. We're following the latest on COVID-19 in the Chickasaw Nation.
Health officials are concerned that positive COVID-19 cases are increasing quickly.
Inside our health system here at Chickasaw Nation, we have been experiencing very high rates of COVID-19 pneumonias in our hospitalized population. As a single infectious disease, COVID-19 now is taking up kind of the same number of beds you would expect with a pretty good flu season. But again, we're also starting to see the beginnings of a flu season start. So it is quite likely that we're going to see an increase in flu as well as an increase in COVID-19. So it's like trying to manage two major flu seasons at once, with the exception that COVID-19 is actually increasing at a much higher rate than we would typically see with influenza.
COVID-19 shares similar symptoms to things like the flu, cold, even allergies. How do we differentiate COVID-19 from some of those other illnesses that are common during this time of year?
With allergies, first question you need to ask is this my typical allergy symptoms that I get? Is it exactly the same as I get every year? If you think back to the previous year, if you have seasonal allergies, let's say you're allergic to ragweed, which is incredibly common in Oklahoma, and it is everywhere. We're currently kind of in the waning stages of ragweed season. The point with that is that you have to ask yourself, if you develop symptoms, are these symptoms the same as I had last year? The second thing is allergy symptoms don't normally just come on immediately. COVID symptoms tend to come on quite quickly when you get them. And so there's a temporality with them. And that's very consistent with a lot of viral illnesses. Viral illnesses will tend to come on in a short period of time, typically hours, maybe a day. COVID, most folks report that with COVID, they were feeling pretty well and then just started feeling really kind of unwell if they develop, even mild to moderate symptoms. The shortness of breath and things like that don't come typically until later in the course of the illness. And in fact, you might get better before that shortness of breath starts or even the cough starts with COVID. The other thing with allergies is typically allergies are going to cause itching. So itching of the eyes, itching of the nose, sometimes rashes and itching of the skin. And then, the other thing with allergies is they typically cause sneezing. And so sneezing is another common feature of allergies. So two things with allergies to really think about. One is, when did it start? Did it start gradually and it's kind of been going on? And yes, this is a typical season and I notice ragweed out there. Yeah. And is it exactly the same as what I always experience with my allergies? If you don't get a headache with your allergies, and that's another symptom that some people will experience with COVID, then you should maybe think that might be COVID. The bottom line is this: if you're uncertain and these are new symptoms to you that you didn't have the last week, you didn't have the previous couple days, then it's probably a great idea to isolate yourself, call in, go get seen, go get a test done, and make sure that you don't have COVID.
So your recommendation is, when in doubt, just go ahead and get tested, right? Because
Correct.
A lot of people may think that those symptoms are, it's just allergies, when indeed it might be COVID-19 or the flu or something else.
Yeah, in fact, I had 4 or 5 people this week alone who reported, they said, I just thought it was allergy symptoms. And when we talk to people about their symptoms, the key points that are different is they did not typically have sneezing and they had a headache. And that headache was not necessarily characteristic of the way they'd experienced allergies in the past. So it's subtle, it's a small change. The headache tends to be pretty significant for some people. Although, if you take Tylenol or other medicines during the day, that might blunt the effect of the headache. And not everyone is going to have a headache. In fact, and this is why this virus is so tricky. Many people have such mild or no symptoms, but they're still infectious. And so the symptoms are really only for a certain segment of the population that actually becomes symptomatic. Even if we just went with symptoms, we're still going to miss a whole group of the population that has no symptoms whatsoever.
Let's talk about testing. The Chickasaw Nation continues to have testing sites open. Those sites offer the flu vaccine, and these testing centers are open to everyone. And so now is the time to get that flu shot, Dr. Krueger.
Yeah, that's absolutely correct. We have vaccinated, I believe we're at Chickasaw Nation Department of Health, we're closing in on around 10,000 vaccines given. And we actually even donated a sizable amount of vaccines to the state to assist them in their efforts and to really help our community also get more herd immunity, if you will, from influenza. So I think those efforts are working really nicely, but we'd like to do at least another 10 to 15,000 more influenza vaccines within the next 2 months. So we have a great way to go and get vaccinated here. You stay in your car, you can drive through at any one of our 4 locations. We're open between 9 and 4. And we have an app, and I'll make sure that that app, the link to that app is provided as well, because people just go online, they sign up for that. If you don't have a cell phone, that's perfectly fine. We'll take care of you even without a cell phone or being able to know about an app. We have trained personnel at all of our sites, and you'll get your flu shot for sure. The one difference with influenza is typically a rapid onset fever and also feeling well. And those symptoms come on very, very quickly. So sometimes you might have to get tested or evaluated for influenza as well as COVID. All of these tests that we use, keep in mind, have their limitations. So if you're symptomatic, it doesn't matter what you have. If you have what we think is an infectious illness, a viral illness or a bacterial illness, until you've either been treated with medication that can make the bacterial illness go away, or until you've been off work for a certain period of time and in isolation with an illness like the flu or with COVID-19, you really should not be at work, and you really should not be out in public, because no matter what you do, you're probably going to increase the risk for transmission to other people out there in the public if you have that. So please, if you are symptomatic, don't go shopping, don't go to ball games, don't go to a lot of other activities that you would normally do, because you're just going to keep that infection spreading across the community.
We are in the holiday season, and celebrations may look very different for many of us this year.
Doctors say it's best to plan ahead, avoid large gatherings, and host events outdoors rather than inside.
Set up the dinner table a little differently, spread out a little further, wear masks when you're inside and not eating. It just doesn't seem natural, but this is the concern that we have in the medical community, that as we approach winter, we're going to have more indoor events like this, and we'll continue to see spread.
We continue to connect weekly with Chickasaw health officials, and we'll share with you more on COVID-19 in the next episode of CNTV.
In other news, a presidential proclamation declares November National Native American Heritage Month. This is a time to recognize the significant contributions the first Americans made to the establishment and growth of the United States. Explore Chickasaw.net to learn about the Chickasaw Nation's history, culture, tribal programs and services, and mission to enhance the overall quality of life of Chickasaw citizens. The annual Holba-Pisachi Native Film Festival is a virtual celebration this year. Typically held at the Chickasaw Cultural Center, the online event showcased 4 areas: workshops, music video, comedy, and short film segments. The film festival reflects this year's theme, a virtual celebration of cultural diversity and natives in the arts. Well, we're glad you joined us online for this episode of CNTV.
We thank you so much for spending time with us. We'll see you back here soon.